We are doing the heart today, and as we know, the heart is 4 chambers, 2 atria and 2 ventricles. So have the right atrium, the left atrium, the right ventricle, and the left ventricle. The separation between these chambers, like this groove and this groove, this is called the atrioventricular groove, which is this groove here. The separation between the atrium and the ventricle. In between the 2 ventricle, this is called the interventricular groove. Interventricular groove means the groove that's in between the 2 ventricles. So right ventricle, right atrium, right ventricle, left ventricle. I'm going to do it the same way as the blood moves in, and this can give us some more options to think about the circulation, how it goes. So this part here, this blood vessel here, this is a superior vena cava, and this one down here, this is the inferior vena cava. Superior vena cava will collect the deoxygenated blood from the upper part of the body, and the inferior vena cava will collect the deoxygenated blood from the lower part of the body. Both of them are going to open to the right atrium. From the right atrium, the blood will go to the right ventricle, and this will be passing through this valve here, that we will talk about the valves more, but this is called the tricuspid valve or the right AV valve. Right atrioventricular valve or the tricuspid valve. The reason why we called it the tricuspid valve is because it has 3 cusps. 1, 2, 3. 3 cusps. So after that, so the blood collects from superior vena cava, inferior vena cava to the right atrium, to the right ventricle. From the right ventricle, the blood will go to this trunk, and this is not called the pulmonary artery, it's called the pulmonary trunk. So this part is the pulmonary trunk. So leaving the right ventricle, going to the pulmonary trunk, and the pulmonary trunk is going to divide into the pulmonary arteries. Right pulmonary artery, left pulmonary artery, and those 2 arteries are going to bring still the deoxygenated blood, going to the lung, getting rid of carbon dioxide, getting more oxygen, and coming back, and they will go to the right atrium through those 2 ventricles. 2 sides, 2 here and 2 here. So those 4, when you see the 4, you're talking about the left atrium. So the oxygenated blood, and that's why it's red, will collect into the left atrium. And this is the exception of the arteries being blue and the veins are being red. So if you see that, this is called the pulmonary artery, but it is blue. Why? This is exception because it's bringing the deoxygenated blood going to the lung. And those 2, even though they are called veins, but they are red. Why? Because this is an exception. They are bringing, this is the pulmonary circulation, different than anything else in the body. So the pulmonary veins are red, as you see, because they are bringing the oxygenated blood from the lung, pour it or enter it to the left atrium. From the left atrium to the left ventricle, and the left ventricle to the aorta, ascending, transverse, descending aorta. If you look at the aorta here, you see the ascending and you see the arch or the transverse. Out of the aortic arch, you will see this one and those 2. It's different from the right side to the left side. This one over here, this is called the brachiocephalic trunk. And we have the brachiocephalic trunk in the right side only. Out of the brachiocephalic trunk, it will divide into the right common carotid and the right subclavian. In the left side, the right common carotid and the left common carotid and the left subclavian arises directly from the aortic arch. So in the right side, you have the brachiocephalic trunk that will give you right common carotid and right subclavian. Left side is different. It arises directly from the arch. This will be the left common carotid, and this will be the left subclavian, and this will be the descending aorta. Now if you open the chambers to see what's inside, this will be the right atrium, and you see these 2 openings here. This is coming from the inferior vena cava, bringing the blood, the oxygenated blood in, and this is the superior, so the blood will come in here, and it will leave through this right AV valve. And if you open it here to look at the valve further, it has 2 names. It's called the right atrioventricular or AV valve, and it's also called the tricuspid valve. If you come closer, you can see that here is one leaflet, here is second one, and here the third one. So it's 3 leaflets, 3 cusps, and that's why we call it the tricuspid valve. So the right AV or right atrioventricular valve is between the right atrium and the right ventricle, and it's also called the tricuspid. Okay, and if you follow these 3 cusps, you will see these fibers here, and these are going to be attached to the papillary muscles. Okay, these are called the chordae tendineae. Tendineae mean like a small tendon. So chordae tendineae attach the cusps to this number 2 here. This will be the pulmonary, the papillary muscles. So these are the papillary muscles, and the papillary muscles, you see around it corrugations. These are called the trabecular carnii, like these here. These are called the trabecular carnii. When the blood is in the right ventricle now, it's going to leave the right ventricle, going to the pulmonary trunk. There is another valve here, which is called the pulmonary valve, or the pulmonary semilunar or semilunar valve. The pulmonary semilunar valve, leaving through the pulmonary trunk, again, not an artery, it's a trunk. And then the 2 divisions are the arteries, right? Pulmonary artery going to the right lung, left pulmonary artery going to the left lung. And then when the blood gets oxygenated, returning back, it will go through those 4 pulmonary veins. It's red, but veins. And it will get inside the left atrium now. From the left atrium, the blood will leave through this. If you look at it from the other side, it has only 2 leaflets. Okay, it has 2 leaflets only. So this will be the left AV valve, left atrioventricular valve, also known as the bicuspid valve, but we have a third name. It's also called the mitral valve. So the right side has 2 names, the left side has 3 names. Right side, right AV valve, tricuspid valve. The left side, left AV valve, bicuspid valve, plus mitral. It's also called the mitral valve. So when the blood collects in the left ventricle, if you come closer here, you see this another valve. This is called the aortic semilunar valve, or the aortic semilunar valve. This will open to the aorta, and from the aorta, the blood is going to leave and go distributed all over the body, upper part and lower part, and so on. So these are the 4 valves. If you look closer here, you will see an opening inside the right atrium. This is called the opening for the coronary sinus. This is where the blood, the deoxygenated blood from the heart itself, will come back to the right atrium and come together with the rest of the deoxygenated blood coming from the rest of the body to the right atrium, to the right ventricle, to the pulmonary trunk, to the pulmonary arteries, to the lung, oxygenated, come back to the left atrium, going to the left ventricle, leaving through the aortic semilunar valve to the aorta, and so on. Now the blood supply of the heart itself. There is an arterial supply to the heart and venous drainage of the heart. Let's start with the arterial supply, how the heart itself gets its own arterial supply. If you look here, this is the origin of the aorta. This will be the right coronary artery. We have right and left coronary artery. The right coronary artery supply the right side of the heart, and the left coronary artery supply the left side of the heart. This is RCA, or right coronary artery, and it will give off this branch here. This is called the marginal artery, and then it will continue. If you follow, it will go to the back here to the posterior interventricular fossa, or the posterior interventricular area, and this will be the posterior interventricular artery. If you look here, you see this is the other artery. You can't move this, but if we were able to move it and take this away, this will be the left coronary artery. The left coronary artery arises from the aorta. It's covered underneath, and then it will split into this artery here, which is called the anterior interventricular artery. and the rest will continue. Here is the other part of it. So this is the anterior ventricular, and this is the circumflex. Both of them come from the left coronary artery that's covered. You don't see it. So the stem itself underneath this area here, this will be the left coronary, and just it will run for a little part for a short distance, and then it will split into this one here in the front, anterior interventricular and circumflex. So those two are the two branches that come from the left coronary. So again, if this is a right coronary, the right coronary will give you two branches, the marginal artery, and the rest will circle around and give you the posterior interventricular, while the left will give you also two branches, anterior interventricular and circumflex. So right give you two branches, left coronary give you two branches. Right coronary give you the marginal and the posterior interventricular, while the left will give you the anterior interventricular and the circumflex. Now the veins. The easy way to tell the veins is if you know the arteries, you know the veins. If you know that this is the anterior interventricular artery, this will be called the great cardiac vein. If you know that in the back here, this is the anterior interventricular, those are the two ventricle, so in between is interventricular. This is anteriorly, so this is the anterior interventricular artery. The vein that accompany here is great cardiac. This is the posterior interventricular artery, which is in between the two ventricles, followed by the middle cardiac. The rule here is all arteries are called coronary and all veins are called cardiac. So with one exception that I'm going to talk about. So any artery is called coronary and any vein is called cardiac. So this vein here is the middle cardiac vein, and this one here that accompanies the left coronary, this is called the small cardiac, and the small cardiac will circle around and will go all the way, and it's also this part here. So the small cardiac will accompany the circumflex, and at the end, if you look at this, and this one here, and this one, 1, 2, 3, plus this one too, all of them will come to this very large, huge, wide vein. It's called the coronary sinus, and this is the only exception. I said that any artery is called coronary, any vein is called cardiac, except this one. So this is called the coronary sinus, but it's a vein. It's a collection of the veins that come from all over the heart. So it comes from here, from the small. Here is another small, and this will be. I'm sorry, this is not the small. This is the anterior interventricular. Will come here to join the coronary sinus. The small from one side, the middle from the other side, and this is called the posterior. So all of them will join together to go to the coronary sinus that will open here. This is the opening. So coronary sinus, we don't see it inside, but it's going to open in this point here. That's called the opening of the coronary sinus. This circle here, this is called the fossa ovalis, and this used to be opened in embryo so that the blood can move from the right atrium to the left atrium, but now it's closed. This is called the fossa ovalis. The last thing here is, if you look at this white part here, this white part is connecting the pulmonary trunk or the bifurcation of the pulmonary artery to the aortic arch, and this is called the ligamentum arteriosum. It's called the ductus arteriosum in embryo, but now it's called, after it's being closed, it becomes a ligament, and this is called the ligamentum arteriosum that connect those two. It's a ligament now. It doesn't connect anything. Changed to a ligament, it's obliterated. It doesn't do anything. It's just a remnant of the duct that used to be here. This is called ligamentum arteriosum. If we're talking about these blood vessels here, you need to recognize those. This is the ascending aorta, this is the arch, and this is a descending. This one here will be the brachiocephalic trunk that will divide into right common carotid and right subclavian, and this will be the left common carotid, and this will be the left subclavian. That's one. The other thing is you have these extensions like this part, just this part and this part. This is an extension from the right atrium, and this is called the right auricle, just an extension like a pouch extending, and this will be the left auricle. So the right auricle is an extension from the right atrium. The left auricle is an extension from the left atrium, just this extension here. The other thing is If you open this and look inside, we said that this is the right atrium, this is the right ventricle, and these are the and this is the tricuspid, or the right AV valve. It will take you to the chordae tendineae, which are these tendons, and this to the papillary muscle. But you see this structure here, and this is called the moderator band. And the moderator band is there to connect the electricity that's coming in here and bring it to the rest of the body. These are the trabeculae carnii, these trabeculae in here. And one last thing is, you can look at the fossa ovalis, which is this one here, which used to be foramen ovalis in the fetus. You can see it from the right, it's between the right atrium and the left atrium. So this is looking at from the right atrium. And if you look at the left atrium, you can still see it here. So, like if I put my two fingers like this, you can see it from one side here. This, which is the same as this. It used to be an opening, but not anymore. Now it's closed, and we call it the fossa ovalis. For the arteries, if you look at this artery here, this will be the anterior interventricular. It has another name actually. It's called the LED, and this, which means the left anterior descending